All right, this is the fourth part looking at mental health conditions, and we're going to look at some adult issues. And I'm putting in the context of my life, not because I'm interesting. I don't even want to talk about it, but it does help you understand if a real person is talking. This condition, I call it a condition, but it has been diagnosed as anxiety disorder and major depressive disorder. It has negatively impacted my life. Thus said, my life is great right now. I'm married to a wonderful woman and things are going good. But it has impacted my life. It has ruined many relationships. I did not get married until I was 49 years old. A lot of the angst that I projected inside, the anger, the anxiety that was projected outward to other people. So I tended to jump out of a lot of relationships after 3 months or so. And it kept me, this condition kept people from getting close to me, this anxious, angry condition. It has both negatively and positively affected my professional life. Positively. What do you mean? This hypomania, and hypo means under, so it's not manic, but it's close to that at times, has given me the energy to write and to excel. But it has made me prickly in certain conditions. It made it hard for me to work with people, or hard for them to work with me. Now, I have experienced depression a lot without knowing what it was before the age of 35, and I'll be talking about this. But the chemicals tend to create negative thoughts, angry thoughts at myself and others. All right? But also this angry thoughts creates the chemical condition. So it's kind of a two-way street. All right? Chemical condition leads to anger, but anger leads to chemical conditions. One of the reasons why it is so important you can control your thoughts and to be aware of the negative thinking or when you are thinking negatively. Turning point was when I was about 34 or 35. I forget which one it was. Now, I had quit drinking back in 1982. I was 32, realized I was becoming a cliche, just drinking a few beers every night, and a few led to a lot. Couldn't go to a bar without drinking too much and getting drunk. So I quit. And the reason why people with an anxiety disorder tend to drink, it softens the edge. And when you quit, it's like the wolf inside you suddenly wakes up and you have to deal with this sense of what was. Now, I started on my PhD, and it was 1994-95 when I had a complete meltdown of anxiety and depression. I was a lot of reason. I was living in solitude, and the stress and pressures of working on this dissertation led me to a complete meltdown. And we'll look at some of the symptoms. But of course, I didn't realize it was a depression or a depressive episode until my mother gave me a brochure, looked at the symptoms, and I was every single symptom on that brochure. So that's when I knew I had to get some help. And here are some of the depressive symptoms if you have 5 or more of those. I was depressed all the time, couldn't get my dissertation done. I was down to 6% body fat. I was working all the time, could not sleep, which is horrible if you go for weeks at a time unable to sleep. Psychomotor agitation, I was on edge all the time. I didn't have much fatigue, but this feeling of guilt, oh, I'm rotten, this, that, all the time. Diminished ability to think or concentrate. I could not make decisions, wasn't thinking clear. And then suicide ideation means you think about suicide. Doesn't mean you're going to contemplate the act or you will do the act, but thoughts of suicide jump in your head all the time. Generalized anxiety disorder symptoms, 3 or more of the following, all right? And for me, it was irritability, muscle tension. Times in my adult life, the muscle tension has been such that the back spasms have sent me to the emergency room. And then sleep disturbance, unable to sleep at night, which is a horrible thing. 3 or more of the following. Now, a hypomaniac is a maniac episode. Hyper means much, hypo means less. It's not quite up to the standard, but any three of the following, and you can stop and look at that. I don't know if I've had a hypomania, but there's this energy. And the thing about mental health issues is different than physical health. The categories aren't as nice and neat because we all think differently. Our brains are all different. So the journey back. Now, it started when I realized I had that meltdown. I had to do something. You go in and saw a psychiatrist, and a psychiatrist back then is just someone who gives you the chemicals or the pill. Now, a psychochemical, a pill, medication alone doesn't cure anything. Pharmaceuticals, psychopharmaceuticals, medication doesn't cure anything, but it creates the conditions where you can begin to cure the soul, to heal, to get back. It creates a buffer around that wolf inside you, if that makes any sense. It didn't change my consciousness. I wasn't high. I wasn't thinking differently. I just was not extreme in my mood swings. Now, it took much psychotherapy, working with the therapist, along with the medication, and along with cognitive behavioral therapy. Essentially, being aware of my thoughts and replacing the negative thoughts with positive thoughts. In my case, I simply wrote down positive affirmations, and this sounds stupid, but I would not allow myself to think negatively. And every time I had empty space in my head, I would simply read through to make sure I had positive thoughts, not negative thoughts. And it took me about 2 years to get back to normal. And I did have a regression, a sense that I started drinking during that time. So I had to get rid of that before I could begin the journey back. Now today I've had a couple of regressions, but I've learned how to realize when it's happening. For me, when I start swearing all the time, have little patients get even more irritated, that means I'm kind of going on the edge. You have to be aware, you have to be vigilant, you have to understand what's happening. And I do have an accommodation at work that helps me deal with depression and anxiety. 98% of the time, I'm able to function just fine. And part of it is the accommodation helps me function. But without these, there were times when I could not teach or write effectively. Now, what helps? Exercise, diet, and daily meditation. These things help. But sadly, when I get busy or stressed, all of this goes out the window. So it's kind of a endless cycle. All right, just a little bit of an understanding. Hopefully you'll have a better understanding of what some of these mental health conditions are or might